I'm Luke O'Neill. I'm Professor of Biochemistry at Trinity College Dublin. I work on inflammation and the immune system and inflammatory diseases. So for many years, I worked on P38 MAP kinase. That is the key target that POLB are going after. And I've got many years of experience of this particular process. And it was implicated first in rheumatoid arthritis as a key inflammatory process. And of course, drugs were developed to block it, to stop inflammation in arthritis. But then lo and behold, POLB got a really good P38 inhibitor. And they got me involved in because I was an expert on P38. And I'm very excited now to see a company taking a P38 blocker. There's huge promise behind this target. The cytokine release syndrome, also called cytokine storm, happens in your body when your body is really irritated by something. And what can happen is your immune system goes crazy and starts to make all these things called cytokines. Now, cytokines are the messenger molecules of the immune system, and they do a great job. They wake up all the immune cells and help our bodies. The trouble is, if they go into overdrive, they become harmful. And that's where this word storm comes from. You get a storm of cytokines, and a syndrome emerges whereby these cytokines are causing real damage. And they can damage your lungs, they can damage your brain, your gut, all parts of your body can be affected. And the reason why it's important is certain therapies are causing cytokine release syndrome, and especially in oncology. So for example, CAR T, which is a T cell therapy for leukemia, 70% of patients get a cytokine release syndrome, and this can be fatal for them. They can die of this. And POLB 001 blocks P38, and that then blocks the cytokines. It's a way to switch off this cytokine storm, and there's a massive need to develop very effective inhibitors of these cytokines, because otherwise the use of these fantastic oncology products is lessened, and then it will increase the responsive rate in patients, and again get rid of these nasty side effects. This is a great development because POLB 001 is a very anti-inflammatory molecule, and it blocks this thing called P38. And guess what? P38 drives the cytokine release syndrome. And so therefore, a drug that can block that will limit cytokine release syndrome. And what's especially exciting is you can give it prophylactically. So before you do the therapy, and it might be CAR T, you give the patient the drug, and lo and behold, that should lower the cytokine release syndrome and therefore have a hugely beneficial effect. And many patients don't respond to current therapies. There's a big need then to develop new approaches. And this P38 inhibitor, this POLB 001, may be exactly what's needed. We've known already it can block cytokines in flu, for instance. And it was simple then to jump into oncology, where cytokines are also problematic. And this drug is able to limit this cytokine release syndrome that's so serious in these patients. Well, it's very challenging to discover new drugs. We really got to use really high-tech approaches. In the old days, it was a bit hit and miss, reading a bit random. And of course, artificial intelligence can now be deployed as a really powerful technology to search for new drugs, to match them to targets that we're interested in, to go after targets we have already and get even better drugs. So AI is seen as a really enabling technology in drug discovery, and many companies are using it. If you're not using AI, you'll fall behind. And of course, what's wonderful is POLB have got two fantastic collaborations with two of the world's biggest AI drug discovery companies. And those then are really helping POLB develop their new medicines. And we feel they will speed up the whole process, whereby we get brand new therapeutics that are maybe even more efficacious than the ones we've got.